Peninsular Malaysia brain and other nervous system cancer incidence, okay, according to the line now, okay, he has reported as 3.6 and 3.1 per 100,000 population of both gender, male and female respectively. That means 3.6 out of 100,000 population of male being diagnosed with brain and other nervous system incidents. And for the female, it's quite a bit lower compared to the male, which is 3.1 per 100,000 population. Okay, of female population diagnosed with this brain and other nervous system cancer incidents. So as we can see, if we are talking about the central nervous systems, okay, one of the most common brain tumor will be the astrocytic glioma. Okay, astrocytic glioma is one of the tumors that originate from the glial origin of the brain. Okay, so this brain tumor, okay, accounts for almost 2/3 of all tumors that originating from the glial origin. So this is one of the most common tumors being diagnosed among the patient. Okay, brain and nervous system cancer incidence was one of the 10 most common cancer in Malaysia. So it's quite shocking when we say it is one of the 10 most common cancers. Okay, so if we see compared the year of 2007 until 2011, okay, it was estimated about 1.1 for male and 1.7 for female per 100,000 population being diagnosed with this cancer. This is specifically for that year. Okay, so in 2015, Aziza reported that this type of cancer ranked as 11th most common cancer in males and 13th common cancer in females. Okay, so the majority of the brain and nervous system by races, we can see Chinese more prone to get this. Okay, followed with the Malay and also Indian. Okay, in both gender. Okay, so I tried to get all the data, information, statistics that are available, published, okay, in the article with the reliable sources and so on. Okay, so these are the data that I have collected for this Malaysian population that facing the brain and nervous system incidents. Okay, so I'm gonna touch about the most common brain tumor. As I said, one of these will be the astrocytic glioma. Okay, this originates from the glial origin, and this accounts for 2/3 of all most common cancer tumors that found in the glial origin. Astrocytic glioma, okay, is one of it. Okay, so astrocytomas are typically classified as phylocytic, which is grade 1, diffuse, which is grade 2, and anaplastic will be the grade 3, glioblastoma multiforme, which is grade 4. Okay, so astrocytomas or astrocytic gliomas, okay, they can be classified into 4 grade 1 until grade 4. Grade 1 is a less severe or less aggressive tumor, followed with the grade 2, and then goes to the grade 3. If it is severe cases, it can proliferate into the grade 4, which is most aggressive one, which is glioblastoma multiforme. I have dealt with all these patients from grade 1 to grade 4 during my research. So I used to get their brain tumors to do my research and so on. So if we compare grade 4, we'll have a more advanced in the blood vessel formation compared to the grade 1 and so on. So those patients with grade 3, they quickly proliferate into the grade 4 with a limited period of time. So the neurosurgeons especially will be struggling to treat the patient, especially in the grade 3 and grade 4, because their survival rate also is much more lower compared to the grade 1 and grade 2 patient. Okay, so as I'm saying about this, okay, repeatedly, astrocytic gliomas is one of the most common tumor. After astrocytic glioma, it will be medulloblastoma, also a brain tumor as well. Okay, so this medulloblastoma mainly invasive embryonal tumor of the cerebellum. Again, this is not from the glial origin. Glial origin will be the astrocytic glioma. Okay. Other than medulloblastoma, we also have meningioma. Okay, meningioma arises from layer of tissue, which is the meninges, we call them as meninges, that covers the brain and also the spine. In America, as we can see, it was reported that patients who were diagnosed with primary brain tumor of central nervous system during the year of 2008 to 2012 was 6 cases, okay, per 100,000 population, 100,000 people. Brain tumors is one of the rare diseases compared to the other types of cancer, such as lungs and breast cancer, more prevalent. Okay, but brain tumor is a one type of cancer which is rare. Okay, so compared to other common cancer which has 10-fold higher incident rates compared to the brain tumors. Even though it's fall under the 10 most common cancer in Malaysia, okay, so but still it's one of the rare cancer. Okay, so the most common primary neurological brain pathology is glioma, account for 2/3 of all tumors, okay, that found in glia origin. Alright, so the two malignant gliomas reported to account for 34.6%, and then this followed with the other brain tumor like medulloblastoma, which is 11.3%. Then the third tumor will be meningital tumors, which is 3.1% of all nervous system tumors in the year 2003 until 2005. So this alone is the statistic for the Peninsula Malaysia. Okay. So the central nervous system tumors, okay, we are going to look at what is the pathology for each type of tumor. Astrocytic glioma, alright, we classify it into 4 grades as I already mentioned before: pilocytic, diffuse, anaplastic, and glioblastoma multiforme. Alright, that will be astrocytic glioma. Okay, if we talk about the medulloblastoma, is another type of tumor. Okay, also can be malignant. Okay, invasive. This originate from the invasive embryonal tumor of cerebellum part, and also classified several subtypes such as we have desmoplastic types. We have medulloblastoma with extensive nodularity, and then we have large cell variant, and also the
so it was published in the year 2018. All right, while I was still doing my PhD. Okay, so this was one of my results, so you can go through of it. So what are the current treatment option available and so on. So you can see the team of scientists examined brain tissue from 22 astrocytoma patient at hospital, Universiti Sains Malaysia. Alright, found that, this is my research, found that endothelial progenitor cells contributing towards the tumor growth. So basically the summary will be my finding. Okay, if we detect the people with the tumor, actually we can detect by their blood itself. Okay, if we quantify the blood, especially targeting on the endothelial progenitor cells, so these cells are the main culprit, okay, because they are the one promoting the blood vessel formation to the brain tumor. Okay, so if we spot the people having more endothelial progenitor cells in the blood, then we can stop, okay, from it is going to the brain to promote the blood vessel or angiogenesis process in order to the tumor to grow. If we stop this, then we have some sort of a good treatment level, all right, for the brain tumor patient. Okay, so that's what they have published and so on. Okay, so you can have a look. Also, they picked up with the certain other news platform also. All right, so if you Google search, you can find it many. I just snapshot few of it. This is from Asia, Research News, Newsmaker. So they publish. Why they publish? Because they really want a new treatment, okay, for the brain tumor patient, because the survival rate is very less. So if we concentrate on the tumor, okay, especially the blood vessel part, it will be much more better. All right, so that was one of my contribution, okay, towards the research. Okay, so this is the picture taken by me last time, maybe 2013 or 14. Okay, so as you can see, this is the patient came for follow-up treatment, all right, going for second or third surgery. Okay, so his scalp was stay intact with the screws and so on. So the neurosurgeon operating his, the tumor, because he faced the relapse of the tumor. The tumor grew back after the resection. So you can see clearly this is a tumor. So this is the scalp, all right. They just open it up. Okay. So yeah. So it can be said that this EPC can act as one of the biomarkers to monitor the tumor aggressiveness. Okay, so also relating on the VWF factor, von Willebrand factor, this will be testing on the function in the platelets adhesion, because when the tumors are growing in numbers, of course the tumors are hard pressing each other and cause the injury in the blood vessels. So that is one of my hypotheses. So if there is a injuries, all right, bleeding of the blood vessels, so what will happen? The von Willebrand factor protein will be transported more and more at the injury sites, and it will enhance with the platelet recruitment to this place, right? So also it will impair the tumor, okay, and indirectly promoting towards the tumor growth, okay. Okay, structure and pathophysiologically, okay, if there is any injuries, come and quickly repair it. All right, so it also can cause the irregular vasodilatation, vasoconstriction of the blood vessels, and in the tumors that leads to the blood vessel injury. So sometimes there is a hemorrhagic tumors that doctors still don't know why it happens. So it could be the reason. So this was highlighted in the publication. All right. So basically, I have tried to associate the blood endothelial progenitor cells with the tumors. All right. So I quantify. You can read through this. All right. All the steps like flow cytometry, ELISA methods available. All right. Immunofluorescence microscopy. I have taken brain tumors and also adjacent normal brain. All right, adjacent normal brain means it is not very normal cell. It's a lesional tissue as well. Okay, but it is not severe compared to the tumors. So I have taken all this and done all these methods. So I found some associations. So these are the overall results. So most of them are grade 3 and grade 4, and then followed with the grade 1 and grade 2. Mean age was 44. Male, can you see there are many compared to the female? This is my hand actually. You can see, all right. So what I do, I centrifuge this blood so that I can separate the peripheral mononuclear cells. So I stain with all these antibodies, all right, incubated, and then I done this flow cytometry. So this will show the cells with the peripheral mononuclear cells. So inside this peripheral mononuclear cells, you can identify the endothelial progenitor cells, all right? How many percentage of it and so on, okay? So the more percentage of the endothelial progenitor cells, that means the severity level of the tumors being increased, okay? So this is the picture showing the tumor part, doing the biopsy, okay? Also this one also from my slide. So these are the staining procedures using CD133 and VEGFR merged together. So can you see the hole? This is a hole here. So define the blood vessels, all right? So I can quantify comparing brain tumor and adjacent normal brain, so I can see well advanced level of formation of the blood vessels in the tumor compared to the adjacent brain, okay? Also make use of the ELISA, all right, coming up with the graph and so on. So as the result summary will be, this is the mean percentage, okay? For the EPC, this is a brain tumor, this is adjacent normal brain. So brain tumor always have the advanced level of the blood vessel formation. So why not we stop that formation to reduce the severity level? So that was my finding. So that's the reason they picked up the the findings and publish it in the news. All right, so this is the equation done for the correlational part, how the VWF affecting the EPC. When VWF is increasing, the EPC recruitment also increase because more endothelial cells required to repair the injured side of the blood vessels, especially in the tumor. So it will indirectly promoting the growth of the tumors. Okay, so there is an association here, but it is not for the adjacent normal brain. There is no association, but there is an association between the endothelial progenitor cells and VWF. This one is significant, but for the adjacent brain, all right, which is normal brain, it does not associate with the VWF. Right. EPC recruited from the bone marrow, so it's enhancing the blood vessels and promoting the tumor growth. Okay, so that's the reason treatment available, hopefully in future, to treat the tumors. All right, so all these are previous studies supporting my studies as well. So as you can see, newly formed blood vessels appear to be leaky, all right, hemorrhagic. Why? They are still finding the results, but I have highlighted in my publication, it may be due to the injury of the blood vessels, all right. So we just highlight as we postulate that the glioma tumor may have severe impairment in the vasculature system, and it is not as observed in the adjacent normal brain. Okay. So conclusion suggests if we target on the EPC cells and also one Willebrand factor, then we can have a good treatment level to increase the survival rate of the astrocytic glioma patient, all right, and also other tumors. So these are my publication. I just snapshot few only. There seems to be very, actually many of it. Okay. You can Google search with my name too if you are interested with the research relating to the central nervous system. All right. So that's all from me.